Now we will discuss various terminologies used in pharmacology. There is a very important terminology which is often used in pharmacology is called agonist. So what are these agonists? These they activate the receptor to produce a response. For example, morphine. So these are those drugs. So suppose this is a receptor and this is a drug. So after binding this receptor, this will give you a response, and that is called, this will give you a positive response, they call agonist. Then there is agonist, antagonist, which is also, there is another term, that is competitive antagonist. So they competes with the agonist, they competes, this is, suppose this is the agonist and this is the antagonist. So they compete with this agonist and they bind to this site, to the same site. It might be reversible and rightward shift in the dose response curve, and they act as competitive antagonist. So agonist, it binds to the receptor and gives a positive response, they are called agonist. And the antagonist, they bind to the same site and gives the negative response, they are called antagonist. And it competes with the agonist, that's why they are called as competitive antagonist. Then there is another term, that is non-competitive antagonist. So this non-competitive antagonist, they bind to this site, this irreversible site, and they reduces the maximum response, they and not overcome by more agonist. Like even the agonist can bind it and it will not overcome by those agonists. They are called non-competitive antagonist. Examples are ketamine or even phenoxybenzamin. Ketamine and phenoxybenzamin. Then there are other terms, for example, spare, spare, spare receptors. So they are the extra receptors present and they produce the maximal response at less than full occupancy. For example, beta adeno receptor in heart. Beta adeno receptors, they are present in the heart. They are spare receptors, they are present in the extra amount and they produce the maximum response at less than full occupancy. Suppose these are the receptors, this is the receptor, they are even without the full occupancy, like some of the receptors are empty, they are available in extra, but still they produce the maximal response at less than full occupancy, even though these are not fully occupied. Then there is a term called addiction, which you will often hear about. Addiction, these are, there are some compulsive, these are compulsive use of the drug. Like you, the patient suffering from the addiction, they will crave for the drug and there will be a withdrawal effect if there is a sudden abruptness, or if there is a sudden withdrawal of those addictive drugs, those compulsive use of those drugs, they will crave for those drugs, and they will also have various different kind of symptoms. For example, opioids or even the alcohol. So the patients become addictive to these opioid and alcohol. Then there is a word or terminology called tolerance. So the decreased response with the repeated use and with the higher dose needed, as there is a requirement of higher dose and then there is a decreased response with the repeated use. Even though the drugs are used multiple times, but the response is decreased because of the multiple use. For example, morphine or benzodiazepines, there will be a achievement of this state called tolerance. The body will not respond to that drug because of its repeated use, and that's called tolerance. Then there is a term called dependence. So this is the withdrawal symptoms on stopping the drug. Suppose a patient is taking certain drug, and if he or she becomes addictive to that drug, and if it is if it is withdrawn, and then there will be various symptoms will arise due to that drug, because the patient has become dependent on that particular drug. That's called dependence. So a lot of people become dependents on alcohol, or even there are many drugs like benzodiazepine. They become addictive to those drugs, and if we withdraw it, like all of a sudden there will be a lot of withdrawal symptoms, and that overall phenomena is referred as dependence. Then there is a tachyphylaxis. I'll write this term for you. This is tachy, T-A-C-H-Y, tachyphylaxis. So what is this? Tachyphylaxis is referred as rapid loss of effect with repeated dose. Suppose there is a drug and it is being used repeatedly, like multiple times, then the body will not react to this drug, and that rapid loss of the effect of this drug, so the effect of this drug will be lost, and that is called tachyphylaxis. It happens in most of the drugs like ephedrine or even nitroglycerin. Then there is another term called idiosyncrasy. 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 This is unusual, unpredictable reaction, often genetic. For example, many genetic drugs, there are some symptoms which are unpredictable, which is not we did not have the intention to have that particular symptom. So we have some unusual and unpredictable reaction, and that is referred as idiosyncrasy. For one of the famous example is primaquine induced hemolysis. Then there is allergy. This term is often used. For example, immune mediated hypersensitive reactions. For example, a lot of people have penicillin allergy. So when the penicillin is administered, a lot of immune reaction happens, and that is referred as allergy. So immune mediated hypersensitive reaction is referred as allergy.